Welcome to my YouTube channel. This is Jamie Naftali on the Paediatric World. Remember, this is the only channel that we talk more about common illnesses that affect children, and we try to talk in a language that mother, that caregiver, that guardian, and everyone can understand. So stay with me. And please, if you haven't subscribed yet, please hit on that subscription button, subscribe, like, and share so that this information may reach as many people as possible. So today's topic is about neonatal jaundice, very interesting. And remember, in our last episode, we were talking about breastfeeding, and jaundice is one of the consequences of not breastfeeding the babies. So if you haven't watched that previous one, please do, so that we may be together and you're able to understand. What is neonatal jaundice? Who is a neonate? A neonate is any baby 0 to 28 days old. So then I'm right to say that a neonate is a 1 month old baby. So these are the babies that normally are affected by this jaundice. So what is jaundice? Jaundice is the yellow discoloration of the eyes, nail beds, and the skin. So it starts from the eyes, and as it goes down, as it progresses down to the nail beds and now to the skin, it becomes even more worse. It is more severe when it comes down. So why are we talking about jaundice? Why are we worried about this jaundice? How does it come about? It comes about as a result of accumulation of something we call bilirubin and into the bodies. So this bilirubin, if maybe I try and explain how it comes about. So this bilirubin, these are metabolites that are normally broken down by the liver enzymes, so that this bilirubin can be excreted or eliminated in a way that there will be no issue without causing problems. So if this doesn't happen, these high levels of bilirubin accumulate, and that's why now the jaundice, the yellowness now comes about. So having tried to explain and knowing how the yellowness comes about and what bilirubin is, maybe I can start by saying that not all jaundice is dangerous. Remember, why we are talking about this jaundice, why we are worried is for these bilirubin levels to be high and reach the brain. So if it crosses the blood-brain barrier, then it causes problems, and this is what we are avoiding. This is what we are worried about. Now, I may say that not all jaundice, not all yellowness is dangerous. Why I'm saying this, it's because 60% of term babies normally get jaundice. And what do I mean by a term baby? A term baby is whereby the pregnancy reached 37 weeks. So that's a term baby. So 60% of these babies normally get jaundice, and 80% of the preterm. The preterm now is opposite of the term. A preterm baby is the one that the pregnancy did not reach the 37 weeks. So 80% of them are bound to have this jaundice. There are two major classifications of jaundice, and number one classification, we call it physiological jaundice. Why is it physiological? We normally say that it is not so serious, and there are characteristics of showing that this jaundice is physiological. And what are these characteristics? Number one, this jaundice appears within 24 to 72 hours of life. So 24 to 72 hours of life. This jaundice does not go beyond 14 days of life. So if it doesn't go beyond 14 days of life, now this jaundice is what we are calling physiological. Like, there's no treatment. Normally we say there's no treatment for this. It can go on its own. So, but however, we normally educate and tell the mothers to come back if there are signs of worsening jaundice. If maybe the mother was in the hospital, the baby had jaundice initially, and then they were discharged home. So we tell them to come back anytime that, like we said, as it progresses down, it becomes more severe. When there are these signs of going now deep to the skin, they're supposed to go back to hospital as fast as possible. So that is one classification of jaundice. The second classification, we call it pathological jaundice. Why pathological? From the word pathological, there's a pathology, there's an issue, there's a problem. So this one needs attention. And some of the characteristics of this, number one is that it comes earlier. It appears within 24 hours of life. So it comes earlier. Remember, the physiological one appears between 24 to 72 hours. So pathological one appears within 24 hours of life. And the bilirubin levels, when they are in hospital, they are usually so high, the levels, very high. And another characteristic is that this jaundice appears even, it goes beyond 14 days of life. Remember, the physiological one does not go beyond 14 days. So this one goes for long, and this is now when we know that this is pathological jaundice. Another thing about pathological jaundice is the treatment. Here, treatment is key. Treatment is required here, and the forms of treatment that we normally have are two. First is something we call phototherapy. And photo means what? Photo means light. So it's basically exposure. We expose these babies to light so that that light can try and dissociate or break down these bilirubin levels. And so that we remember, we are saying the dangers, why we are preventing it, why we are worried is so that these bilirubin levels do not cross the blood-brain barrier. They do not go to the brain. Why? Because when it reaches the brain, it comes with long-term complications. The baby will have long-term complications, meaning they will have issues that they will continue with for the rest of their life. For example, we have something called cerebral palsy, for example. So the treatment of pathological jaundice involves phototherapy and something we call exchange transfusion. The pathological one, for you to know there's a pathology, normally the stool, when you're changing the diapers, you notice that the stool of this baby is somehow whitish, and also the urine is dark. So when you notice that and your baby is having jaundice on top of that, then you should seek medical advice. You should take this baby to hospital. Jaundice, what causes this yellowness? What are some of the causes? Number one cause is something we call rhesus incompatibility. Rhesus incompatibility. What does this mean? It means that for instance, the mother is rhesus negative while the baby's rhesus is positive. So there is usually a reaction, and this is what we are calling incompatibility. Normally, the first baby is not affected. It is usually the second one that is affected. There are memory cells that are left, and these are the baby when he comes, when the mother gets pregnant for the second born, then these memory cells are can recognize the first reaction. So this baby, the second born, now gets a yellowness of the eyes. So this is how it comes. That's why it is important, mothers, when you are pregnant, please do take those antenatal visits more serious, because it is only during this time that you're able to know your rhesus. So it is very important, so that if it's known, there's a way that we prevent this reaction, and it's by giving something we call anti-D. Maybe some of you know about it. Those who are blood group negative, you know about it. So it's normally given at 28 weeks gestation, when the mother is pregnant at 28 weeks, and again repeated before 72 hours elapse after delivery. So number 2, infections. It could be fungal, it could be viral, it could be bacterial, and also hepatitis in that list. We have other things like bleeding. If this baby has got bleeding, then they can have the yellowness of the eyes. Other causes, we call them causes of prolonged jaundice. When do we say that jaundice is prolonged? We normally say it is prolonged if it goes beyond 10 days in a term baby. Remember, we said a term baby is that whereby the pregnancy reached 37 weeks gestation, and if it goes beyond 10 days in a term baby and beyond 14 days in a preterm, this is when we term this jaundice as prolonged. The causes of the prolonged jaundice now, mostly they are usually surgical, like the digestive system. In the digestive system, there are surgical abnormalities, so of the liver and all that. So mostly it is surgical. So these are some of other causes of jaundice. So what is the approach of the jaundice? When you see jaundice, what comes to your mind? What is your number one thing to tell? Number one, we think of the birth weight is very important. So why? Because low birth weight babies are at high risk. This is more of like risk factors to jaundice. So low birth weight babies are at higher risk of getting this yellowness, this jaundice. And who do we say are low birth weight babies? Normally, the normal birth weight is between 2.5 kgs to 4 kgs. So babies below 2.5 kgs are at higher risk of getting jaundice. Another risk factor is gestation. Gestation is what we are calling up to how many weeks does this pregnancy go. So if the pregnancy is below 37 weeks gestation, now again these babies are at more risk of getting jaundice. Remember, we said that we are worried that these bilirubin levels do not reach the brain. And if it reaches the brain, we normally get those long-term complications we are talking about. We call it kernicterus. Kernicterus is when now the baby starts manifesting long-term complications, like we said, CP, cerebral palsy. And how does this baby present? This baby with kernicterus, with this, when the bilirubin levels reach the brain, the babies are usually so weak. They do have poor feeding. They are not able to breastfeed well. They don't have things we call reflexes. They are not able to attach themselves to the breast and suck well. So another presentation of these babies is convulsions. Maybe in layman, I can call them tremors. I don't know. This is the easiest way I can call them. So tremors, convulsions. They present with convulsions. Another thing, they have a posture. They assume a very funny posture, and you're able to know that this is a symptom of kernicterus. So having said all those, I believe and I'm sure that you have learned a lot, and don't miss out, because this is it for today. In our next episode, we shall be looking at now the management of jaundice. And thank you so much for listening to me. Thank you for your time, and keep subscribing if you haven't. Like and share, and don't also forget to leave a comment down there. So this is Jamie Naftali on the Pediatric World. Thank you so much. Till next time. Bye bye.